Well, good evening, everybody. Thanks so much for joining in. My name is Dr. Sam Shamardi. I'm thrilled to spend this evening with everybody on this topic of solving the patient payment dilemma, how to turn a no into a yes, a really important topic, obviously, for all of us as dental professionals trying to kind of navigate the waters and get some positive treatment acceptance. So really excited to spend this evening with everybody. Come down with a pretty rough cold over the weekend, so I'm hoping my voice holds up. As you can see, I am a practicing full-time periodontist in the city of Boston. I've been teaching as a faculty member at the postgrad perio program at Harvard for the past 11 years, which has been great. And fortunate enough to be a member of the Catapult Education Speakers Bureau. And for those interested in kind of getting their financial career started, especially the early career professionals, I published that book, The Financial Survival Guide for Dentists. So just a little bit of background about myself. And again, I really appreciate everybody being here. We've got quite a bit of stuff to try and cover for you in this short webinar. So without further ado, I'm going to get the ball rolling and we'll do the questions at the end. So obviously we want to send special thanks, one to our sponsor, Sunbit. Appreciate their efforts in getting this put together and supporting the program. And of course, Viva Learning, which we're all using now, hosting us on this lecture tonight. So thank you both. So really the overview for what we're going to be talking tonight is this primary challenge we all face, and that's basically patient acceptance of treatment. And, I wanted to break it down into this short time that we have into really two different fields. One, we've got the factors that patients have to deal with and how that interacts with us and how that really, creates a big dilemma for them in terms of deciding whether or not they want to move forward. And then, of course, there's some practice factors and solutions as well that we want to introduce for tonight's lecture and get through. So that's going to be kind of the overview of what we're going to be discussing together tonight. And with that being said, we'll get started with the first section, which is really looking at different types of patient factors that really come into play in helping us decide and the patients decide whether or not they're ready to move forward with treatment. The first one, of course, I don't think it really needs much of an introduction. All of us, unfortunately, have to deal with this every day as dental professionals from our patients. But as we are fully aware, the literature has shown that anything between 50 to 80% of adults in the United States have some degree of dental anxiety, ranging from mild to severe. Personally, I would even put that number at a higher amount from the patients I see, but maybe that's speaking as a periodontist, that might be different across the board. They furthermore go to the point of saying that about 1 in 5 dentally anxious patients don't even see a dentist regularly. And there's about 10 to 15% of those patients that are avoiding care altogether simply because of this anxiety that exists, again, that we're all too well aware of. This same article went and broke it down even further into more specifics. What they found based on their little chart that they created there on the right in terms of kind of lengths of anxiety, they found that the moderate to high anxiety was about 1 in 5 of the patients that they tested. This coming from the Journal of Dental Hygiene a couple years back. Surprise for me, at least, was that they found a higher precedence in prevalence in women compared to men, which I would say my experience has usually been the opposite, but that's what they found. Understandably, anxiety has increased with age once they've gotten a little bit more used to being around the atmosphere in the office. And it's really not so much an issue of the procedure as much as it is just obviously being in the dental chair itself. So, we've all heard it all from our patients. How many times a week I hear about, doing this perio surgery was worse than giving birth. And, I've had, twins and that was a piece of cake compared to seeing you and all the stuff that you hear like that. And you can see from this Journal of American Dental article, dental fear, that percentage and prevalence was on a similar scale as fear of snakes and physical injuries. So again, a very well established source, but something that we can't take lightly because ultimately a lot of our patients aren't willing to move forward with treatment, no matter how simple or complex, simply based off of this anxiety and fear. which then really brings in that dentist-patient relationship. And the biggest thing is the development of trust between patient and doctor. And there are a couple different things that the literature has kind of pointed out as being critical factors. Some of that trust comes from the assurance of confidentiality. Patients want to feel that they're in a safe place, and whatever their condition may or may not be is really something that they can share in the privacy of that operatory, and it won't be going beyond that. The other thing is that the procedures being recommended to them are being done in their best interests and without any ulterior motive. And really also this recognition of patient autonomy. And we're going to talk about that in the next couple of slides. What we found, and one of the big things that we're fighting against, as this article by Carr pointed out, was that approximately 1 out of 3 patients consider us, the dental professional, to be both dishonest and opportunist. So if we're fighting that at a baseline on top of the anxiety that we just pointed out on that slide before, from the patient standpoint of things, we're obviously at a tremendous challenge before we've even been able to present treatment as a result of these two things combined. Now, talking about trust that we mentioned, Chappell had a very good article in 2003, which basically pointed out that the patient's confidence in their dentist's integrity was really, going to give them more comfort in taking a more passive role in deciding treatment plans. So the more comfort and confidence they had in their dental professional, the less they felt that they needed to be directly involved, and the more they kind of felt at ease and comfortable with whatever was being recommended to them. Halpern kind of took that to the next step and said, a lot of that has to do with the personality of the dentists themselves, those who exude a sense of humanity and compassion, those that show empathy, the amount of dental anxiety that was able to be, reduced as a result of that, and therefore giving them that confidence and comfort to wanting to move forward were directly related. So, really communication, they concluded, was the key. They felt like a lot of patients as well, being such a melting pot in different cities across the country, those who they felt they could identify with their, cultural and ethnic backgrounds and just have an overall good personality, really went, light and bounds to helping them at ease with their anxiety and helping them move forward. So, the other aspect that they pointed out was that patients, especially at the beginning until the point that they feel comfortable, do want to be involved. So, they feel that if they are able to be directly involved in the decision-making process, that will be a direct, function for them, again, developing this confidence in their dentist. And the longer and more time as a dental professional we can spend with our patients, at that initial consult visit and even at subsequent visits, if they feel that we're trying to rush them out of the room and push them on treatment, of course, that doesn't work. But if we are able to provide the time and really give them a sense of caring for their treatment, that obviously goes above and beyond. So the type of paternalistic model that maybe, that sense existed more before, back in the day, where it was kind of, we're the doctor, we tell you how it's going to go. It seems like that is been discarded, or has been recommended to be discarded, more in favor of doing more of an egalitarian approach, which would really give them a sense of decision making. And I can tell you personally, as a periodontist, I actually incorporate this directly, not just because of the patient comfort, which of course is a big thing, but I also find that making patients directly a part of that treatment planning and decision process also puts some of the responsibility on them as well. So I think it's, especially for bigger treatments and things that can, possibly have complications or long-term aesthetic and functional changes, it's always good that the patient is directly involved, so that they are, also accepting treatment, accepting responsibility, and it makes them not only feel that they're part of the process, but they're also taking some of the ownership. Another factor that really can't be discounted is time. So as we all know, the only thing that patients want to have for their treatment is to have it done yesterday. There's always a tremendous rush of how long is this going to take? They sigh and they moan and they complain. Of course, try and get an appointment to see your primary care physician, and they'll tell you we're not available for 4 months and nobody will bat an eye. But a dental professional that doesn't have time to be immediately seeing their patient or get their work back in a timely fashion is suddenly getting a bad Google review. But not just from the time to get them in, but we even have to just think about the cases themselves. So as we all are very well aware, there is a lot of time that the lab has to do work. There's some cases that involve some more elaborate pre-planning, whether it be, the wax ups and showing some mock-ups to the patient. In situations that I'm dealing with on a daily basis, there's long periods of times that patients either have to wear some type of a flipper or Essex appliance because of a tooth that is going to be removed or is missing. So certainly, especially in the aesthetic zone, we all can identify and relate to that patient that the thought of having to wear this for an extended period of time doesn't sit too well with them. So we're also having to deal with that factor. So obviously, we all have millions of examples that we can relate to. This just being a standard example of a typical case I would see on a daily basis. A tooth that has been broken down below the gingival margin and is deemed non-restorable, that we've gone through the A to Z of removing the tooth, allowing for healing with the bone graft, and going to an eventual implant. Well, the reality is in a lot of these types of cases, that process can at times take from anything to 6 to 8 months, depending on the wound healing, depending on the amount of bone. Obviously, there's a lot of factors that go into it, but the bottom line is on a standard, more traditional case, this can take 6 to 8 months. And then in cases that are more involved, that either there's a much bigger amount of augmentation that needs to be done, more of a complex medical history, soft tissue augmentation, et cetera. Some cases can take upwards of a year plus. So you can imagine having this discussion with the patient on the front end and trying to lay this all out to them from the beginning and explain to them the process. There is a tremendous amount of pushback to initiating treatment when the thought is I might be going through this process for upwards of 1 year. So we cannot discount the effect that time has on a patient's decision whether or not to move forward and say yes versus saying no for their treatment. Of course, there are other factors, and we cannot ever discount the money, the cost, and the coverage. And we're going to talk about that and obviously segue that in our next section. So again, depending on where in the country that you live, this is just a kind of a generic list. I believe this was from the ADA, where you just see a list of some of the more traditional dental procedures and their costs. Obviously, dental treatment is not inexpensive. And I can say, just looking through this list, where I'm located here on the East Coast in Boston, those prices across the board out here are actually even more expensive than what you're seeing up on the screen. So costs, of course, are a primary, if not the primary factor for our patients, which we're going to discuss in detail in the next section. And what you can see, and I thought this was crazy until I read the article myself from the Dental Product Report a couple years back, they said up to 80% of patients would actually consider not even having local anesthesia if it meant that it would reduce their bill. Imagine that. That's just how important this cost factor plays. And of course, we're all aware of that because now we have to deal with the phenomenon, which of course is dental insurance. So according to Forbes, about 2 out of 3 of the population has dental insurance. So obviously enormous percentage and proportion of our patients. And the other thing that needs to be mentioned is if you kind of take a look at some of these different examples of insurances on the screen, where you are located also makes a significant difference. So a patient, for example, living in Alabama with Delta Dental PPO, their individual premium, they're looking at that cost of around $26. But you look at that same insurance in Los Angeles, for example, and that is almost, you can see, over double, almost close to triple the cost. So depending on where you're located geographically, the actual amount of coverages and those premiums play a significant factor as well. Now, the other thing we all know, much to our chagrin and extremely to not only our, but our patients' frustration, is what the insurances will actually do for us and for our patients. And of course, the answer to that simply is not much, not enough. And with time, this is not getting better. In fact, as we all know, it is just continuing to get worse. So looking at things from preventative services to basic services and some of the more major services, the amount that the average insurance is potentially able to cover is pretty minor in the big scheme of things. So a patient throughout any type of year, through the course of that year that would need treatment on more than one or even just one tooth, those costs, of course, will go far beyond what their insurance would be potentially covering for them pretty quickly, leaving them with this large out-of-pocket cost. And there are plenty of patients of mine, I can say again, from my standpoint as a periodontist, I have patients who will get teeth out in January, and they will, wait until the following year to do anything from a, next phase restorative standpoint, simply because that's when their insurance will renew. So too many of our patients are reliant on this. And as we are seeing on the screen, and as we all know from experience, what the insurances are doing for us is obviously not much and not enough. As you can see, the chief economist and vice president of the ADA Health Policy Institute pointed out, dental insurance is really not even a true insurance in the sense that it's protecting us really from catastrophic costs. It's really just more of a prepaid benefit. We know going in for the year what we're going to have, but we know at the same time, if we do have a more major procedure that comes up, that really insurance is not really going to do much of anything for us. So that's a tremendous source of frustration, and something yet again we are going to address as part of our solutions coming in the next section. Also, looking at this from a different way, really the main interpretation of this is just to point out that the amount of patients that really are looking at just doing things out of pocket is not that different than those going through insurance. From a money standpoint, again, simply because the insurances aren't really doing much for them from a coverage standpoint, and a lot of their work that they do ends up needing to come out of their own pocket, which of course is of pretty big frustration for them. So those are just some of the factors from a patient's point of view before they've even, really had anything done from us. That anxiety, again, that fear, the cost, the time, these are all things in that trust and communication that really play a big role into deciding whether or not they are willing to move forward with treatment. Now we're going to discuss a couple things from the practice side of things and see how those can incorporate and what things that we can do as dental professionals in our practice to help increase this conversion. The first one sounds really obvious, but as I'm going to point out, is actually a really underutilized issue, and that's just diagnosis and recognition. And what we mean by that is the simple diagnosis of the actual and recognition of the actual issue at hand. And what is it that I mean by that? Well, one really simple way that a lot of this discussion with our patients is flat out missed and overlooked is our radiographs. So I can show you in each of these examples that I'm putting up are cases of mine from my own, from one of my practices over the years. And each of these are examples of patients who were not referred to me for any type of periodontal issue or treatment. These were all issues, these were all patients that I happened to just kind of poke my head in and take a look around. And what basically was happening was that on the bite wing, it looked like everything was fine. But once we updated with the periapical radiograph, as you can see, there was a pretty significant vertical defect and loss of bone on that molar. Here is yet another example. If I was to show this as a bite wing to a dental professional, their first thought would probably be all is well, let's move on. But of course, you take that periapical and we're seeing, well, two problems, frankly. One, you've got an implant combined with a natural tooth, which of course is a no-no. And in addition to that, you can see again a significant vertical defect there. Last but not least, another bite wing here, which maybe at first glance may not be anything that's been noticed, but again, take a closer look with a PA. and you see again a significant amount of bone loss and a significant issue. Like I said, none of these patients presented with pain. None of these patients came in because they had an issue or were being referred for periodontal treatment. And the big problem that I see across the board is that we simply don't like taking periapical radiographs. You go through a patient history and you'll see every couple of years there's been 4 bite wings taken. But what is a bite wing showing us in the big picture? Well, obviously it's showing us nothing for the anterior teeth whatsoever. And for the posterior teeth, as you can see in these examples here, there is a tremendous amount of treatment that is being missed just for that simple reason. So this is obviously an instant practice changer. I've been a part of a lot of practices that really, dedicate a lot of time and funding and finances towards a very kind of robust marketing plan and really trying to go out and bring new patients and work with their existing patients to show what they're doing. But a lot of times just the most simple thing of taking some of these periapicals by themselves is an instant practice changer and a very, a free source essentially of a lot of, production for the practice. And just to show examples of how significant these things are from a clinical standpoint, again, you can see how deep and how big these defects are when they were actually accessed surgically. Again, I don't think any of us would look at any of these clinical photos and think that these lesions and these areas of bone loss were insignificant. So part of us getting the patient to actually buy in to what it is that we want to do and getting them to want to move forward with treatment also comes down to us to actually being able to recognize that there's an issue going on and to diagnose this in the first place. So this really comes into play. And one great new resource that I'm really happy to share with everybody tonight is this new advent of artificial intelligence, which we're going to talk to in just one moment. This last slide I wanted to show also plays to this point from a different standpoint. This is a patient from a hygienist colleague of mine in the West Coast, working in Utah. This patient presented to their practice. Obviously, you can see not even a periapical, but from this bite wing, the areas of bone loss, furcation involvement, and significant calculus. The hygienist was told by the practice owner that they were to do a simple prophy for this patient and nothing else. When the hygienist pushed back and said, no, actually, this really looks like it needs some scaling and root planing, the response of the owner was, yeah, you don't need to be working in this practice, you can leave. So again, going back to what we discussed, a lot of times our own recognition is needed first before we could even get our patients involved. And something that's going to make a tremendous difference for that is what I was just mentioning with the new advent of artificial intelligence. So how is this going to play a significant role? Well, we know our patients are hesitant to begin with. We know they have the anxiety and all those factors that we talked about. And of course, until we've developed that trust with the patient where they're going to take our recommendation, what better than to be able to provide a secondary source of proof that in fact there is a problem with their dental condition, whatever it might be, and being able to show that with artificial intelligence to help our patients, again, change that no into a yes. And let me go into talking about what this is and how it works. And these are from my good friends at a company that is new into the dental marketplace known as Pearl. So how this basically works is the following. With artificial intelligence, there are computer systems that can now simulate the problem solving and decision making of humankind. And just to show why this is really a significant problem, I think a lot of us off the bat would be like, well, we don't have any issues diagnosing cases. Why would I need to utilize this? Well, this is a great example of that. And we're going to start and show a case that was presented to 136 dentists. They were presented in FMX, this one that you're seeing below. And in being presented this FMX, they were then presented this specific bite wing. Of course, periapical would have been good, but again, they were presented this specific bite wing and asked the simple question of, is there anything going on this tooth? Is there any type of decay, infection, resorption, anything of any kind, yes or no? And if so, what? And the results that came out of this were pretty surprising. what they ended up finding out was that 136 dental professionals of our own colleagues could not agree on what was going on this tooth. In fact, almost exactly 50-50 across the board. Half of those 136 dentists said there is no decay of any kind on that tooth. That tooth is perfectly fine, thank you very much. Whereas the other half said, oh, wait a second, I see that bite wing, there is decay present on that tooth. To break that down even further for those within that decay, about 40% of them said there was no recurrent decay of any kind, whereas 60% of them said, in fact, there is recurrent decay. Well, that's a pretty drastic difference. Again, if half of our colleagues are saying one thing and half of them are saying another, look at that huge discrepancy that's there, and imagine what that means potentially from a daily standpoint for what radiographs we're looking at, especially again if we're not updating and taking as many films as possible. Well, so now they went further in this example to show another tooth. And in this case, they mixed it up. And what they did is they showed this lower molar, and they basically said, okay, we know we're going to tell you right now that there's decay and there's a problem on the distal of that molar. The question isn't whether or not there's an issue. The question is, in your office, from start to finish of this case, imagine you inherited this patient and you were going to treat this tooth. How much would it cost you from day one until you are completed with treatment? How much would your treatment plan cost from start to finish? And the results that they found, as again, we found on the last slide, were quite surprising. About 26%, 1 out of 4 of those dentists surveyed said that they could treat that tooth from start to finish for $500 or less. About 1/3 of them said it would cost between $500 to about $1,000. 20% of the dentists said it would cost somewhere between $1,000 to $3,000, and 16% of our colleagues surveyed said it would cost from anything from $3,000 to $5,000 to treat that one single number 19. So the point of all of this is simply to point out that there is a tremendous amount of variance and discrepancy among our own colleagues in terms of whether or not they feel there is even an issue going on with the tooth. And number two, if there is the identification of an issue, what exactly would be involved from a treatment standpoint. And this is where AI comes in to be able to plug that hole and provide us with what is known as another opinion. So you can see from these 136 dentists surveyed, a whole treatment plan from A to Z on this FMX. The range from these 136 dentists range from $300 to treat this patient from start to finish to up of $36,000. And the amount of diagnostic concurrence, the amount of dentists of this 136 that agreed on the radiographs was less than 50%. So this is where Pearl is coming in, and they've presented this problem, and what their solution is by providing artificial intelligence. And specifically, their software is very keenly named Second Opinion. So what Second Opinion is, and I'm going to show you, and you can see on this diagram right now, is the following. There are two very important things to note with Second Opinion. First of all, as the name entails, it is an opinion. The name of this software and the goal of the software is not called alternative diagnosis. Okay, so this software platform is not out there to give you the diagnosis and tell you what treatment needs to be done, but rather it is there to help identify areas of bone loss, decay, resorption, periapical lucency, etc., based on the radiographs that it has, and to therefore, by pointing that out to you, allow you to identify that and then be able to move on, decide what you want to do from a treatment standpoint. So you can see this platform goes through a lot of different forms that you can get through. This, for example, will help break down whether or not there is a carious lesion. It will give you a sense of how much of it is in dentin versus enamel. You can see those bone measurements that it has from the CEJ down to the bone level to help identify areas of bone loss. Like I said, it does the same with periapical lucencies and whatever else it might be. So using their practice practice intelligence software, which syncs up directly with whatever you have in your practice. Really, the number one goal of using this type of technology is the keyword of opportunity. You can see that up there. So what the software is able to do, it is able to review all the radiographs for the patient that is scheduled, for that day, the next week, etc. And when you look at your schedule for the following day, for example, it will already help point out for you, here are the amount of patients that need to have radiographs updated based off the last time they did it. And here are the potential amount of opportunities that are present, whether it be a potential endo opportunity, an implant opportunity, a restorative case, whatever it might be. So again, the goal of this software is simply to point out the fact that there's something going on. And again, from our patient standpoint, especially from those who are hesitant to move forward with treatment and those who give us that look of, I don't know if you're trying to swindle me, or I'm not sure I completely trust you, to be able to come forward and be able to say, hey guys, look, here's what I found. Here's what I've diagnosed, and not just me. We even have artificial intelligence that is doing the same. And here you can see where it's identified you've got a large area of decay or a periapical lesion or whatever it might be. The ability to gain more of that patient confidence and make them more willing to trust what you're suggesting and be more open to moving forward with treatment as a result of this is obviously going to be tremendously higher on top of the opportunity it provides you as a dental practice. So it breaks things down into a lot more detail using the software. Of course, we're not here to go through all of that, more just to give you a sense of different screenshots of their dashboard. But really, that is one big area I think worth considering. Again, we need to first diagnose and accurately recognize that there is a problem going on. If 50% of us are not able to agree on a simple FMX, imagine how much potential things we may be missing in our hygiene checks because we're in a rush. We've got an extremely busy day. What better than to know that before we walk in, that we've got this type of software program ready for us to go. So that has to do with diagnosis. The next part from a practice standpoint, of course, is office management and scheduling. And what do we really mean by that? Well, the biggest challenge that a lot of patients find in trying to, join a new practice or call as an emergency visit is that people don't pick up the phone. So what patients have found through the articles of literature that are out there, 87% of new patients have been either directed to a voicemail, put on hold, or not appropriately greeted and never called back. And of those that were polled, almost all of those patients, 86% of them said they would even be willing to pay more if they had that type of a positive customer service experience. So the difference between the practices, and this has been done through Dental Economics Magazine, among many other dental literature sources, what they've basically found is that the average typical dental practice responds to about 80% of the calls coming in. That means they are missing 20% of the patients that are calling. Now, if you look at the top 10% of dental practices that are present in the country that, again, have been studied and published by Dental Economics, they are responding to 95% of the calls. And they are able to convert 75% of those into some type of treatment. So the difference between being a more kind of average dental practice to being in that top 10% is a difference of, picking up about 80% to 95% of the calls. And you might think, well, how big of a difference is 15% really going to make? And well, what ends up happening when you miss these calls, well, there's the 3 R's that you're missing out on. Obviously, revenue. If you think about each month, if you only miss 50 calls per month, and think of the average patient only needing about $300 worth of dental care, that's already $15,000 a month that is being missed. And then, of course, from the reputation and referral standpoint, how many of us know the patient that has the emergency who we are able to pick up the call, bring them in and treat them, how grateful they are, and what's the first thing they start doing? They write you that great Google review. They start going and bringing all their family and friends over. So the consequences of that 80 to 95% are pretty robust. To just look what this means from a long-term benefit, to be that average dental practice that we talked about to that top 10%, there is a gain of at least $150,000 in practice revenue per 100 new patient calls. Again, based on the study that was done and some of the stuff that's been published by Dental Economics. So do the math, and really what we're finding is that a lot of the problem is we're not able to pick up our patients' calls, and that by itself is making us lose out on a lot of work. So what we really need to try and look into and invest in is some type of all-in-one dental practice management tool that can help plug all those holes. And one of them that's new that I wanted to introduce everybody to is known as Casper. And what Casper is, it's a cloud-based productivity platform that is streamlined and automates all the essential components. Very, of course, straightforward, simple to use. It is the only all-in-one software that pairs directly with Open Dental. And anything you want to talk about, whether it be paperless forms, picking up those patient calls for you, doing online appointment scheduling directly into your patient software and directly into your schedule, VoIP and patient communication, texting between rooms with staff to say your patient is here, put him in room 4, and all of the analytics and reviews that all dental practices now are starting to get more into. All of this type of practice management, it does everything. It's an all-in-one type of solution. So the goal is not only to elevate and enhance the user experience, but to really provide an all-in-one solution that is going to cover all those bases for you. So again, they have their own software and their own platform. And, again, what they're able to do, not only are they able to give you that all around practice standpoint, so you can have good idea of metrics in terms of what you're doing and what's going on. But again, just from the standpoint of what we discussed, showing in that literature from the patient call standpoint, to have a service that if your office is not able to pick up, automatically goes to a call center dedicated to the practice. They're guaranteed that that patient is going to have somebody pick up, speak on behalf of that patient in that practice. They will be directly linked with your schedule, and they will be able to then get that patient on your schedule and get them in your books. So not losing that opportunity is going to be tremendous. And again, taking that patient who is hesitant and not sure about moving forward with treatment, they see that they're getting this type of an immediate response. Again, the literature has shown that this is a tremendous practice change and a big change that is really making the difference between being the average office and the top performers. So again, everything is cloud-based. As you can see, office chats, auto reminders, task management, you name it. They really do everything A to Z. So I encourage each of you to at least look into them, see what they're doing, see if it's a good potential match for what your practice might be looking for. But again, from what we've seen and from what the literature has shown, it's a small line from being average to the elite. And again, the difference, the proof is in that pudding there. The last couple of things we're going to discuss. Well, we did talk a little bit in our first section about insurance and how we're basically now, it seems like more and more getting held captive. A lot of our patients are deciding to do treatment or not do treatment solely based on whether or not their insurance will cover it. Of course, we've got the opposite problem sometimes where we actually have patients who are wanting to move forward and have treatment done, but then what ends up happening is that there's a missing tooth clause or some other ridiculous clause that the insurance has that they're not able to work with, and therefore they're not able to have treatment. So are we going to continue to be victim to insurance? Well, there is now some solutions to that, and one of them I wanted to introduce to everybody today, offering what is known as in-house and membership insurance plan. And this specific group I want to share with everybody tonight is known as PlanRise. And what PlanRise is providing is a membership-based dentistry program for your patients at your practice. So rather than going through traditional dental insurance, you basically, as a dental owner and as a dental practice, are setting up your own in-house membership insurance plan of your own. And you are dictating the terms for what that insurance is going to be in terms of how much it is going to cover. So rather than Delta coming and saying, we'll cover 50% of preventative, 30% of restorative, or whatever that might be, you can decide exactly what percentage of what type of treatment is going to be covered based off of your practice needs and what you want to do. You can personalize and individualize this for each of your patients. So you can make this custom for everybody, or you can make it more generic across the board. Now, PlanRise's argument is something that we can all identify with. The dental insurance reimbursement rates that we've talked about earlier on in this lecture, they've declined 6% in 2018 and over 8% in 2019, and those are just continuing to get worse. So having this type of in-house membership plan is going to really become a big difference and something that we as dental professionals can use to push back. Not only will our patients get all the benefits, if not even more, but we are not going to be bound and held by what those insurance companies are saying to us. So a lot of this that you're going to see is, again, as I mentioned, you are able on your own to automate your own custom membership plan. It will help, obviously, with patient loyalty because you'll be able to work on that plan together with one another. I do like pointing out, because obviously it's important to know what other groups are out there. PlanRise is not the only one out there. You may have heard of other companies like Clear, for example, but what has made PlanRise unique, which I like about them, is that some of these other companies out there that are currently offering similar types of services are charging a per patient type of setup, whereas with PlanRise, it is more of a monthly fee. So once you have enough patients that are engaged in this program, it is obviously going far and above and beyond what other programs are doing. But bottom line, to have that type of an option there and go through their program, which they allow you to set up a free account, take a look at their platform and what it's doing, to be able to provide the patients that type of a plan, and to tell them, hey, let's look at what your needs are, and based off that, if your periodontal condition is in great shape, let's put a lot of your benefits towards restorative work. You're not a perio patient, but you get decay very commonly, so let's put the majority of your benefits, let's set that up from the restorative standpoint, or vice versa. It will allow you to customize that for your patient, and again, will really go a long way, not just in terms of gaining their confidence, but from a patient that wants to go from a no to a yes, to be able to provide them this service and not be bound by insurance and say, we will work with you and we can, now get this treatment done that you otherwise wanted to do as well. It really goes a long way. So again, configure your plans, set your patient profile up on your own, and again, take it from there and you can get the job done. Now, the last thing I want to talk about is probably, I would argue, the most important part of this whole lecture, not just because it comes from our hosts at Sunbit, but as we mentioned throughout this course, there's a lot of factors from the patient and the practice side that come into deciding whether or not our patients want to do treatment. But as we all know, cost seems to be the biggest one. We just talked about things in this last section from an insurance standpoint and how big of a role that plays. But as we all know, even in cases where we might even have a good insurance, the amount of residual costs that are left are so often exorbitant that the patients are simply not willing to move forward. So we're thrilled to talk to you about this new solution for patients financing, which is known as Sunbit. And the beauty of what Sunbit is I'm sure most all of you have been experienced or aware of other types of programs that have existed out there. Probably CareCredit is the one everybody has heard of the most. And we're going to show what makes Sunbit not only unique, but significantly better than CareCredit or anything else on the market. So again, about 40% of our population, according to this CBS News article, can't even cover that surprise $400 emergency expense. And there's obviously a lot of hardship that's going on. And as we can all really relate directly with this colleague of ours from the state of Colorado, we've had so many times in our progress notes where we have to write patient unable to complete their treatment due to the financial situation. Well, how much care are we missing out? How much care are our patients not having that they greatly need as a result of this? Well, let's take care of this issue right away. Dental economics has showed that the case acceptance on average for established patients in our practices are between 50 to 60%. And for those that are new patients in our practices are only 20 to 25 to 35%. Case acceptance, unfortunately, is very low, which is why we're all here. So when we look at traditional financing, and again, you look at CareCredit or any other company, and we'll mention them in a little bit, this is an overall graph of how this all works. So when you look at the amount of patients that are actually approved, the sad part is that only 40% of our patients that apply for funding and financing are getting approved. And of course, those 40% that are getting approved are those that are in the high credit score area, that's 700 and above. What that basically means is that there are 60%, therefore, of our patients who are either getting declined or, of course, those who have an even lower credit score who don't even bother applying. And as we all know, we've had how many patients that we can relate to that come to you right off the bat and say, I have such a low credit score, I don't even want to bother applying for a CareCredit or anything because I know I'm going to get denied. So if we are having 60% of these patients decline, what does that mean for the amount of treatment that we're losing and the amount of patients that aren't getting the work done? Well, another colleague in another practice in Dallas basically pointed out that 60 to 65% of the patients that they were trying to get financing for were simply getting declined. So the office just stopped offering it. They got tired of going through all the hoops and all the process and background checks and credit checks and time on the phone just to see that patients weren't getting approved at all. So they were getting frustrated and basically saying, well, we're tired of this. Well, so what is it that Sunbit is doing that is so unique? Well, there's this tremendous area of missed opportunity within that 60%. And as you can see, these are all areas that LendingClub and CareCredit are denying. But on the flip, Sunbit is doing something unique, which it is providing funding for the vast majority, 8.5 out of 10 of those patients, even within that 60% range that are traditionally denied. So again, think of the game-changing, change that this is bringing for us. We've got this enormous part of our patient population, which may not even have a poor credit score. They may have just a moderate, a respectable credit score, but they will be denied by a CareCredit, LendingClub, or other type of service. CareCredit on the flip side will say no. Sunbit, however, will say yes. They will provide funding. In fact, Sunbit will match or do better than anything any of the other lending companies will do, even for those patients of high credit. And the other thing that makes Sunbit so unique and so special is that they are also taking on that responsibility and that burden. What does that mean? One of the biggest fears for us as dental professionals, and especially for those as practice owners, is that you have a patient that you take a risk from a financing standpoint for a very big case. And what happens partway through the treatment? That patient vanishes. They just kind of fall off the face of the earth, and now you're left with this tremendous responsibility, interest charge, etc. Sunbit is taking that to another level because they are actually taking on that risk on themselves. So as a dental professional, as a dental practice, that is not something you also have to deal with and manage. Now, as you can see, the actual finance rate with those very low credit scores is going to be a mixed number that they will find for each individual patient. A lot of times patients come back or practices come back and think, well, that's a high amount of an interest for a patient that's like that. But what you have to keep in mind is that if that practice interest is 30%, that's still 70% that's going to be coming towards you as a dental practice that you otherwise would not have had. So really important to keep in mind. So again, they are approving more than 2 times those of who apply. So the amount of new net production that you are able to capture as a result is through the roof. The other thing I want to point out before we wrap up, which makes them so unique, is the actual process to go about getting the approval. Like I mentioned, CareCredit takes time, getting on the phone, sending an application. It also involves a hard credit check. One of the biggest reasons people are hesitant is because they don't want to have their credit score affected further just to get checked and then get denied. But for those who use Sunbit, this process, I can speak from personal experience because I went through it as a test myself. It is the fastest thing I've ever seen. It took under 30 seconds. There is a soft credit check. There is nothing that is going to be done to your credit score. Again, you are going to get this extremely high approval rate without any chargeback. And it was as simple as me taking an iPad, which Sunbit will provide your dental practice. And I put in my name. They took a scan of my driver's license. And within a period of, I swear in my case, I was maybe 15 seconds, not only did they have all of my information, but in my hypothetical case, where I put in how many thousands of dollars of financing I was looking for, they automatically came up with the approval amount for how much that they would provide me financing, and along with what the overall purchase price would be and the monthly payments would be. So that whole process broken down into monthly payments and what the overall financing is going to be was provided to me within 15 to 20 seconds without any kind of hard credit check or any other work involved. So imagine your patients in the room, you have them at the front desk, they're maybe a little bit hesitant. They don't know if they want to move forward. You're able to provide them within 30 seconds this information right off the bat and say, hey, look, we know you don't have a good credit score, but boom, look, you are going to have funding for this. And again, the amount of patients that we are now able to convert into wanting to move forward with treatment, because of course, money is king, and now they've got the necessary financing as a result of this to move forward. So what they're doing is fantastic. Sunbit will go the extra mile to do professional training. They will spend time both online and plan a full hour with all of your office staff to train them. Of course, the process is as simple as what I showed you, but nonetheless, they're always there for all customer support. You're not going to be dealing with a robot, but rather with actual human beings. And like I said, they do provide that iPad for the practice and round-the-clock support. So you can always have somebody to reach out to for help. And again, what they're doing is unique, and I think something that is really going to shake up the patient financing, standpoint of dentistry. So here's just one example that you can all relate to. A patient of mine in the past, this patient needed full mouth extractions. So, if it's a case of just extractions and immediate dentures, let's say this patient had an average credit history, what would be the final cost for your treatment? And will he be approved for treatment? Well, in this case, maybe there's just extractions and immediate dentures, even with an average credit history. Maybe he would be approved for this by another lender, maybe not. But let's say this patient wanted to go the extra mile, and this patient wanted to have dental implants and implant-supported denture and have something that would be both more permanent and involved. Now we're talking about a treatment case with treatment plan with multiple implants, a new final denture, obviously locators, bone grafts, and a lot more involved. Now you've got a treatment that is going to cost a significant more. Well, how is such a patient with a moderate credit score and such an expensive treatment plan going to get approved? And of course, this is, again, one of many examples where somebody with this Sunbit financing can get the approval they need. And you can go from a case of having the patient needing to just do dentures and missing out on having this significantly improved final treatment simply as a result of patient financing and funding. So they are making a tremendous difference and somebody worth treating. And as other practices have been firsthand speaking, they've seen a significant increase of their patient approval rate simply because of this. The additional revenue a lot of practices are seeing right off the bat as a result of this, of course, is also significantly higher simply because of the financing that they're getting approved for. So again, highly recommended for everybody to take a close look at this and take this into serious consideration. So a lot to look into with that. And like all the other platforms that we mentioned, they also have their own software that will help you know from a daily, weekly, and monthly and yearly basis exactly how much revenue have you generated, how many patients have applied, how many have been approved, what your conversion rate is, and it will help you track all this. So again, the proof is in the pudding, and you can see all of the proof for yourself. So with that being said, just want to wrap up. We'll get done right through on time here. In conclusion, as we pointed out, patients are naturally dental phobic and they are cost and insurance driven. Developing trust is paramount with that dentist-patient relationship. We need to spend time, especially because our treatment can sometimes take a very long time. So having that empathy is going to go a long way. AI, we've shown as providing further assurance for hesitant patients and helping with treatment acceptance and being able to show them a secondary source, proving that what you're saying is really what's going on. Now there are office management solutions that exist to maximize your scheduling, picking up those phones and your efficiency, which is going to help patient conversions. And we also have now in-house membership insurance plans, which never existed, which can help us finally start getting the upper hand and not being dictated to by insurance. And last but not least, we now have a new patient finance platform that can literally transform production and getting our patients to say yes to a large portion of that segment base that otherwise would have been denied funding. So a lot of excitement there. I know we reviewed a lot of stuff. Again, it's a lot to get through in a short time. So I appreciate everybody's attention. This is a picture from Boston Harbor. A big thank you to everybody. Again, our hosts, Sunbit and Viva Learning. If anybody would ever like to reach out, this, by the way, is my dog Luna, who's been staring at me with this headset on, being like, why do you look so weird? You can feel free to reach out. That's my website there with just kind of information and upcoming courses. You can definitely reach out by email and by social media as well. So I appreciate all your time, and I will go through any questions at this point. All right, so a couple questions here. One question here: would a panoramic radiograph allow for a better way to understand the patient's oral condition? I'm not sure if this is in reference to what we were talking about with the AI, but I will make a point of saying the way that works is that they will take all of your existing radiographs that you've had for all your patient base, and obviously those that you start taking moving forward, and they will convert it onto that platform with the AI. Overall, do panoramic radiographs help? They obviously play a role, and they help identify, pathology and anatomic things like the location of the nerve and the sinus. So there's a lot of use for it. I think the key point from what I was pointing out in my topic with the radiographs really is just to go the extra mile and not always rely on 4 bite wings. Again, the sheer amount of dentistry that is missed. I just showed you some examples from my own practices. The sheer amount of work that we overlook because we're only focused on bite wings is really pretty significant. So it's just worth looking within and spending that extra time to do that. So in regard to that second opinion, software and platform, the best would be to reach out to Pearl as far as any questions regarding, what they do and, funding, financing stuff. That's not something I have, information privy to. So it looks like those are most of the questions. Let's see through here. Thank you. Thank you very much. Yep. Appreciate all your time. Yeah, looks like that's it for questions. So again, feel free to reach out with anything else. And again, thank you for spending some of your time on this Monday evening, and have a great week.